Predictors of periapical bone healing associated with teeth having large periapical lesions following non-surgical root canal treatment or retreatment. A cone beam computed tomography-based retrospective study. This retrospective study was conducted last month by a Spanish group led by Carolina Barriero, with other authors from different universities. One of them is from Jazan, Saudi Arabia, Department of RDS. So the idea was to study the changes or healing or non-healing of large lesions from 10 millimeters and above following non-surgical treatment or retreatment. It is not possible to differentiate clinically or radiographically whether the periapical lesion is a granuloma or a cyst, or to even diagnose. This information can only be gained through accurate histopathological diagnosis of the entire lesion and root apex. The aim of this study was to evaluate healing of large periapical lesions, determine minimum follow-up following non-surgical root canal treatment or retreatment. The secondary objective was to analyze the effects of initial volume, age, gender of the patient, type of treatment, type of root filling on the healing time. So they had 79 individuals with non-surgical treatment or retreatment, and inclusion and exclusion criteria was as follows. Cases included were from 10 to 15 millimeters in their greatest diameter. They were followed up every 6 months at least, and CBCT every 1 year. Excluded teeth were teeth with minimum remaining tooth structure extracted from non-endodontic regions, and who developed and extracted teeth during the follow-up of 48 months. The clinical procedures were conducted by 5 endodontists. 47 of these cases were retreatments and 32 were primary root canal treatment. Their findings was that age was a significant factor in healing, in addition to the size of the lesion. So age was the only significant difference between healed and non-healed. A 1 year increase in age increased the healing time of periapical lesions by 4.9, in addition to the other prognostic factor, which is the initial size of the lesion. So they concluded that these two factors should be considered while analyzing large lesions, and they recommended 6 months follow-up of these cases. In my opinion, it has been well established that size of the lesion makes a difference in prognosticating. However, the age of the patient, especially in this retrospective study, it's very difficult to conclude or to make a statement like this, especially that we know the drawbacks of retrospective studies and the idea of these patients having systematic disease are higher in these age groups. However, they did not mention any association with diabetes or other systematic diseases. Thank you for listening.